When Sandra found out she was pregnant for the first time, it was a surprise, but a welcome one. Like many soon-to-be mothers, she was nervous, but assumed that during labour she would be made to feel safe. She was wrong.
I was very shocked to find out when accessing maternity care, I was sent home 5 times, I was dismissed, I was ignored. It felt as if they didn't care. My basic human rights, I don't believe, were met. In fact, I felt like I was a pain or a nuisance. I was told that my cries and my screams didn't coincide with my labour contractions. So it felt quite dehumanising at the time, and I was so upset.
Sandra was so traumatised by her experiences, she quit her day job to start campaigning full-time on the issue, where she quickly learned that many other women that looked like her had similar stories to share. Data shows that black women are 4 times more likely to die than white women due to complications. Asian women were almost twice as likely to die than white women. And women living in the most deprived areas were 2.5 times more likely to die than those living in the least. And whilst the data is shocking, it's not new. The government acknowledged these disparities last year and committed to setting up a task force to explore the reasons for these poor outcomes. But a damning new report by MPs says that whilst the task force is necessary, it's currently insufficient.
The task force doesn't have specific metrics that it's measuring its outcomes. So the reality is that if you're not measuring what the interventions are achieving, if you're not getting data in real time so that you can see those interventions, whether they're working or not, and therefore roll out the ones that are successful, then really it isn't much more than a talking shop.
The government says it's invested £165 million since 2021 to grow the maternity workforce and has a plan in place to tackle disparities on a local level to improve outcomes for all mothers. But Sandra says that women of colour cannot be protected when the racism that they experience is ignored.
It exists and it's alive, unfortunately, and it's affecting and killing black women on a day-to-day basis and our children as well.
Shimon Freeman-Powell, Sky News.